So we have three panelists joining in this discussion. Prof. Sri from University of Indonesia, a pediatrician who is also who has done a lot of work on dengue. Prof. Adi from Gajah Mada University, and I'll let her tell us a bit more about what's going to happen next. And then, of course, from Singapore, Professor Lee Ching from the Environmental Health Institute, who's really active in implementing Wolbachia in Singapore, but in context that is perhaps more pertinent in Singapore.
Good afternoon to all of our audience. Let me focus on the third technical element of the global strategy for dengue prevention and control, that is sustainable vector control. Control is of mosquito breeding places and also community behavior are the main problems in dengue prevention. See the figure of dengue incidence in Indonesia seems to be plateau within several years. It means that the dengue prevention should be evaluated. The other emergency situation is almost 8 months in this year. We face two burdens of disease, dengue and COVID-19. 10 among 34 provinces have highest incidence and increasing incidence in 6 cities. Some cases came worse because the doctor did not aware for dengue, but still focus on COVID-19. With mosquito program is the international collaboration research a new approach in dengue control strategy that transmitted by Aedes aegypti. The epidemiological trial that rolled in Yogyakarta is the only study which done within WMD global collaboration, which is a new innovation of Wolbachia inoculation. The objective of this study was look for Wolbachia's role in the reduction of dengue incidence. Although this program did not implemented yet in all over the country, impact in dengue clinical is clearly significant. The result is reducing case incidence by 77%. It's surprising for all of us as a clinician that face and manage dengue cases every day. Other impact that should be appreciated was the community participation and support this program. Hope that the result of this study will become the complementary method in dengue control in Indonesia and other countries in the world. So ideally, this Wolbachia program introduced simultaneously with dengue vaccination as other innovation strategy should be implemented and increase the power of dengue prevention strategies. Finally, after the excellent result of Wolbachia trial in Yogyakarta has been delivered and spreading to all of us, implementation in the country needs further effort. Get the recommendation and decision making for policymakers are the first step should be done, followed by training, education, and communication to achieve reduced death of dengue at least 50% and dengue morbidity 25% by years 2020 compared to 10 years ago. Thank you so much, Kem, and also the team of this WMP project. Thank you very much for your attention.
I think they're all excited with this result. The community is certainly very, very happy. And Cam has told us that even now we've already started releasing in the control area. With the stakeholders also, they've been actually with us during the journey, during the 10-year research. So from time to time, we inform them about the development of the research. And now with the final evidence, I think we have been discussing with them closely how should we move forward. So certainly they are very happy and very open also to know that there is a new intervention that could complement I think, to strengthen the dengue control program. So what is next is that one, we've started the release in the control area, and then for the following year, I think we will do the scaling up in the different districts, but still within the same province, while we are also discussing with the government and also with WMP also what's the best strategy to move forward for the national scaling up in Indonesia.
I think it's a really, really nice study, nice results. Congratulations, Cameron and team, and Adi. I think fantastic.
Thank you.
I think the dengue world should have a celebration. It's fantastic, right? I mean, our region, that in 60s, 50s, we have been struggling with dengue, and when I joined this field, I felt that it's so primitive, the tools that we have had for so many decades, and there have been very little breakthrough in controlling dengue for decades. So finally, I think it's a tool that bringing down dengue by close to 80%. I think it's amazing. So when are we celebrating, Cameron? Yeah, so in Singapore, we are using Wolbachia in a different way. We do the suppression method, so we only release male mosquitoes, and in a small area, but still a big population of people, almost I think equivalent. We are also seeing that kind of numbers, that kind of suppression, 60 to 80% suppression of dengue. So I think Wolbachia, whether you are using it in the suppression form or the replacement form, seems to be very promising. Of course, both have got its strength and weakness, pros and cons. And I think these two methods using Wolbachia is really good for dengue world. I am very impressed about how you convince residents to accept the mosquitoes they are releasing. Adi, I don't know how you do it. I think it's amazing. The numbers that you're releasing, the females that you're releasing, or in total, right, is 2 to 5. And in fact, we release, even though we're doing suppression, we release about the same number. We release about 2 to 6 male mosquitoes per person. So it's equivalent number, even though we are doing suppression. I guess, so, and it works even for suppression. Of course, then for us is that we have to release continuously, and also we need to sort the females, the males from the mosquitoes. How much dengue? How much do you still see dengue in these areas, especially after you have there's a spread and you have released more even in the control side? Because I think your 80%, as you said, maybe your situation may be better than 77% because of the movement of people. So when you overcome the whole area, I guess the dengue suppression would be, the dengue impact would be higher. I'm just wondering how much residual dengue do you get? And I'm also wondering, Cameron, why Rio only had 49%? What are the parameters, what are the factors that influence the success of this technology? Well, one place you can get 70%, 70+%, another place 49%.
Yeah.
And also, you mentioned about the use of complementary tools like vaccine and other tools to complement. That's related to how much more dengue do you have. So my question is then, what more is necessary to reduce further dengue? Have you thought of the hybrid system? So replacement and suppression?
Yeah, so yeah, I think they're all very good questions, and I don't want to answer them all. I think maybe I'll answer the piece around just the differences from Rio to Yogyakarta to Vietnam. They've all got their own design and their own basis for dengue case detection. I would say in Rio and neighbouring Nicaragua particularly, the really complex urban landscape where we don't have nice, clean, homogeneous Wolbachia establishment through what is effectively a large area with favela areas coming through that are difficult to work in. And so it's a more heterogeneous landscape of Wolbachia establishment in Brazil compared to certainly Indonesia. With respect to what, I agree. I think we're going to see a very substantial effect in the public health indices of dengue when the next dengue season arrives. And of course, that's coming soon. It'll start raining in Yogyakarta in December, maybe November. And so, we've got a dengue season about to arrive. We're really interested to do that active case detection in the same model that we've done the trial, but also use the passive surveillance indicators and see where does Georgia rank in the league table of cities for badness of dengue in Java, for example. So I put the microscope on Yogyakarta, and I think everyone should. I think it's going to be a fascinating case study for the next 3 to 5 years. And can we get dengue elimination? We've found that this particular strain of Wolbachia WML doesn't like it hot in the aquatic phase. And so if you're in an ecology where the breeding sites are getting certainly over 30 degrees, there's a likelihood of curing Wolbachia out of the mosquito population effectively. And I think that's what we've observed in a small pilot study in central Vietnam. It's clearly not the case in North Queensland, not the case in Indonesia, it's not the case in Colombia or Brazil. And so there may be environments or ecologies where WML is not the first option. The other Wolbachia strain that Lee Ching, for example, is using for suppression, WLB, has a wider thermotolerance profile, and so still delivers virus blocking, but is a bit more tolerant of breeding sites getting hot. So.
Yes, I think obviously community engagement is very important for several reasons. First, they have been informed actually since 2014, and that's when we released in the small scale. So by the time that we released in the large scale, the community kind of already heard about the Wolbachia intervention in the small scale. But then as we went larger, we tried to use, of course, a more of a mass media approach and not so much relying on the household or on the face-to-face interactions. So we use a different innovative also way of informing people. Use a lot of medias, TVs, and social medias also. And then this was I think quite challenging, because we need the community to be informed and then to give the consent regardless of whether they will be in the intervention or in the control area. So that means they need to understand the technology, but also they need to understand that this is still a trial, a research phase. So by doing a community consent, what it means is that we use maybe we call it kelurahan or under the sub-district level. And then for the trial, we are talking about around 35 kelurahan. So with each of these, we explain about the community consent. They can tell us who they want to be present during that process. And then it's through this consent that we have to do with the community. So certainly the consent was done after we felt that the community has been informed and that they have an idea of the consent and of the trial itself. So after that, then we did the randomization. And during the randomization, which was done in public, so we have the representative of the communities also in that randomization. And then they during that process, they really saw which areas are intervention areas and which areas are control areas. And I think what I remembered was those in the control area, they actually expressed their disappointments. Why they were not, be in the intervention area. So that shows that the community accept this technology very well, but they also appreciate that this is still in the research phase.
Related to this, I'm sure there must be some negative responses. And how do you deal with those who are against the idea of releasing mosquitoes?
Yeah. I think when we talk about the challenges, you're right. I mean, certainly we've had challenges from the community. However, the challenges was not so much about against the technology, but it's more of the technical part of, for example, they were not willing to take care of the small bucket where we put the eggs in there, because they have usually the common reasons is that they have an elderly in the household or they have babies in the household. So it's more of a technical challenges rather than against the intervention overall. So in Yogyakarta city, we hardly have any sort of challenges or against this technology.
So running a trial is a double-edged sword. You need dengue for the trial to deliver a result, but of course you don't want that for the community. 2018 was a very quiet year for dengue in Georgia. 2019, a lot of dengue, and Q1 2020 also a lot of dengue. But what we're showing in the trial and indeed through the passive surveillance system is that dengue was in the untreated areas of Yogyakarta city, not in Wolbachia treated areas. And then in relation, will the viruses evolve? We think about evolution in two ways. Wolbachia may evolve and attenuate in the mosquito over time, and that may take a long time, hundreds of thousands of years. Or the virus population evolves. It develops a workaround of the Wolbachia block. Because of Wolbachia is setting up an antiviral syndrome inside the cells and tissues of the mosquito. There's not one single mechanism in action here, and so we think, and there's good evidence to think this way, that it's going to be challenging for the virus to evolve a workaround against the Wolbachia blockade in the mosquito. If it does, it may take a long time, and that virus may not be very fit for onward, epidemiologically fit. So we're trying to do it in the laboratory. Can we make Wolbachia resistant can we make the viruses resistant to Wolbachia? And we haven't been able to do it yet. It's a PhD killer, and so, but we keep, it's an entirely perfectly sensible question, and something we need to keep thinking about with any intervention against this type of virus population.
Yes, I think eliminate dengue is very difficult result, because Indonesia is very wide country, and geographical is very difficult, and some of remote areas still have the education is also very varied. The question is, after we have the success of prevention strategy, up to now, maybe we can evaluate it first. But it's not easy to evaluate the social condition like the dengue in the public health setting. But to do this program, it's not easy too, because it's also costly and need all the participants from the community. And about the vaccine, vaccine actually is already put in the what is called multi-year plan in our government. But now we have COVID, and also we have some outbreak for polio. You know that in Papua first, and then moved to Philippines and also Malaysia. We have in Sabah area. So we still have homework in this other infectious diseases. So I think, but it's already queuing in the program in Indonesia. Hopefully, in the short time after finish the COVID pandemic, we will again back to our old plan.
I'm not sure whether we can eliminate dengue with just dealing with Aedes aegypti, because we still have Aedes albopictus. Mm-hmm. So that could be responsible for some low-lying numbers as well, right? And if you look at the recent outbreak, more recent years outbreak in Guangzhou, where albopictus-driven dengue can go rather big as well, rather huge. In the past, albopictus-driven dengue are typically small, not more than 10,000. But the Guangzhou outbreak was huge. So has the mosquito or has the virus evolved that they are able to replicate in albopictus well, just like what chikungunya did in 2000, in mid 2000s. Mm-hmm. So looking at other arboviruses, we still have. So again, I think dengue we need to do. The game is not over. It's a big step forward. I think big advancement, but we still need to take care of albopictus after aegypti. In terms of Zika, which is also spread by Aedes aegypti, and we published a paper showing that Wolbachia is able to block Zika as well. So this methodology, whether it's suppression or replacement, should take care of Zika just as good as dengue, if it's not better. I believe that yellow fever we'll see the same impact on yellow fever. But chikungunya is going to be it's a problem that is maybe not so taken care by this, because chikungunya can replicate in albopictus very well, as I mentioned. Mm-hmm. So quite complex, because the partnership, they change partners and they evolve and change partners at the same time. Then of course we have the Japanese encephalitis, which is then Culex borne and West Nile. So I guess more job to do, but dengue is the biggest problem with urbanization, is really escalating. And even if we can just stop the escalation, I think we will have accomplished a lot. Yeah.
Our messaging is always to continue standard of care, vector control at the household level, at the municipality level. Continue doing what you're doing. Now, most places are not like Singapore, where vector control has an impact on the mosquito population. We see fogging events occur through Yogyakarta, an abundance of Aedes aegypti, nonetheless. And so the reality is most vector control activities are poorly directed, using products that the mosquitoes are resistant to, and simply not applied in the right places where the mosquito is. And so maybe adding can speak to the Georgia situation, but certainly our messaging is always carry on with vector control strategies, even though quietly we don't believe they work.
Adi, anything more to add?
I wasn't. I cannot really hear what Cam said, but I think what I would like to say is that by examples and by working together with the community during the trial, we are showing to the people that we encourage them to continue doing what the program advised the community to do. So, because just by working together with them, it's more effective rather than just telling people what to do. So this is a joint community effort, and they know that we encourage them to strengthen the program while we are also doing this Wolbachia intervention.
Not in Indonesia, and so I think, but we also spent a long time, and credit to Adi and the team in Georgia around socialising the science to the community and to stakeholders, and so the answer is no. Very much moving away from adult releases, and so egg-based releases are simpler, likely to be more productive in the field, include some community engagement, so there's a lot of benefits to egg-based releases. We think the underlying fundamentals of the biology are universal. And so there may, look under different seroprevalence scenarios, the modelling North Queensland demonstrates that even in a very highly susceptible population, we're still showing evidence of a public health benefit. And so I guess our strategy is to do demonstration projects in major endemic countries and show that the biology of Wolbachia works the same way it does anywhere else. The biology is unchanged, and to build some early public health evidence using their own local indicators with pragmatic epidemiological study designs. You can't do an RCT in every country. There is no funding to do that. That's the brutal reality. So it's a pragmatic approach that builds on gold standard evidence from the RCT, demonstration studies replicating the biology of both Wolbachia, but replicating the public health outcome in a pragmatic way as well. So, but the point is a good one. Everyone wants to see evidence in their backyard, and we get that.
I don't recall having seen albopictus. I don't know, Cameron. But for suppression, yes, China, Guangzhou has been using for suppression purpose and very successful as well in Guangzhou. Because in Guangzhou, they are really dealing with albopictus. Yeah, but PIP in albopictus, Wilson is here, so I'm asking Wilson. No, I don't know any studies that have shown. Cameron.
Yeah, albopictus is naturally infected with two different strains of Wolbachia, WLA and WLB, and it's been in albopictus for evolutionary time. And so most of the Wolbachia is sitting in the ovaries of the mosquito and not in the epidemiologically important end of the mosquito in the salivary glands. And so really the lab evidence is quite, really no evidence that Wolbachia, the naturally infecting strains of Wolbachia in albopictus, confers any resistance to dengue or chikungunya.
No, not the natural one, but let's say PIP in Wolbachia.
Sure, yeah, you can do a single infection. Yeah.
PIP in albopictus.
Yeah, or male. You can do a triple infection, or you can clean out the natural residents and have a single infection with WMAL or WPIP. So you can do the same biological approach of albopictus. Entirely feasible, probably sensible at some stage in the future. There's a lot of areas of diptone that needs to be addressed first.
Yeah, agree.
Yeah, I wonder perhaps also something to do with the season, because we actually have a few spikes also, but not as high as the one spike that year. But then we have a smaller sort of spikes throughout the year.
I think if you need your umbrella to go to work or to the office, it coincides with the first pulse of wild material coming out of the egg bank in January.
So perhaps also with the, I'm not sure if the behavior of the people once also it's at certain time they were very enthusiastic to do the breeding sites control, but then sort of not really consistent throughout the year. Certain times maybe they are more active once they heard dengue started spreading in the community, but then I think overall throughout the year breeding site control maybe as it is not as systematically implemented and continuously implemented by the team.
Yeah, you're bringing up Adi.
So there's I think a complex factor to understand.
Yeah, apologize for that. Adi is on the road. As Cam said, it goes up mainly with the rainy season in most parts in Indonesia.
Maybe I'll start, but then actually Lee Ching is one of the few global experts in mass rearing at the Yogyakarta. So you're right. One of the main bottlenecks is producing enough mosquitoes, and so to scale to industrialize the manufacture for us mosquito eggs, and so that, and really the suppression field has led the way because of the numbers they need to make in industrialising mosquito production, and they're largely using animal blood, probably exclusively animal blood. But Lee Ching can speak more.
Sorry. Hi. So for the production, in fact, it's only for the stock colonies that we need to use blood. Whereas the actual production, it will be just fish food and sugar solution for the actual production, right? So we only use blood for the stock solution, stock colonies, and different labs have use different blood source. I've heard of cows, pig, sheep. Yeah, so we don't need exactly human blood. They adapt. You can adapt them to different blood type.
Yes, once again, congratulations for this team for wonderful work, and hopefully it can expand it to other areas in our country. And once more, thank you also to Cam that you work so hard, and I think Prof. Adi and team also as a champion in our country. Thank you so much for this opportunity.
Thanks, Ray.
Lee Ching?
Okay, congratulations. And before, when you go home, I don't know, maybe you're at home now. Is do the mosquito wipe out. Go check for water in your home. Make sure there's no bleeding. Especially now because we're all working from home. A lot of people are working from home. Your exposure to mosquito is very high. So go check for mosquito breeding in your home.
It's true.
Cam, any last words?
No, I think really just to reflect on the trial result. I think we were surprised at the magnitude of effect, given the spatial area we were working in where people are mobile. What it says is that the place of highest risk of dengue acquisition in this city is in the home, and I'm really excited to see what happens in Yogyakarta over the next 3 years. And I'll happily take a good bottle of wine bet with anyone on the call today that Yogyakarta is going to eliminate dengue as a public health problem in the next 3 years. I'll happily take a good bottle of wine with anyone tonight. So let's book in our calendars in 3 years' time.
All right. So maybe that's the we should all bring wine for the next Asian. So I want to thank Cam for taking the time to prepare the talk and share this exciting data, and then for Prof. Sri, Prof. Adi, and Lee Ching for taking the time to join us in this discussion, and all of you for logging in. I know it's very early or late for some of you, and I appreciate your participation.